All right. So this is what works for jowls between 40 and 60, part two. So if you missed part one, we went through the panicked glass of wine or two induced search spiral that happens at like 11 p.m. when you look in the mirror and realize that you may be starting to see some jowls staring back at you. And in this video, what we're going to do is talk about what works, what doesn't, before you start spending money on a bunch of garbage. So welcome back to the Trillium Show. My name is Dr. Jason Hall, board certified plastic surgeon here in Knoxville, Tennessee. This is a Trillium Show where we focus on improving your mind, your body, and your life, and hopefully save you some money and keep you from getting taken for a ride by the aesthetics industry in the meantime. If you missed part one, talk about the panic-driven search spiral that tends to happen when you look in the mirror and realize you may start seeing jowls or a little bit of saggy neck. Some of my patients refer to that here in East Tennessee as a goozle. Where that came from, I have no idea. But it's pretty common around here. People talking about it's pretty common around here. People getting it, probably pretty common too. So let's kind of talk about things that work and things that don't. So first thing that everybody thinks about is skincare. Everybody wants a potion, everybody wants a cream, everybody wants a serum that's going to improve the jowls or saggy neck. And let me kind of start this discussion by saying no skincare product is going to fix that. Retinols, peptides, growth factors, all of those things, they're great for skin quality. They certainly have a role. I wrote a whole book about it. So, check that out. I talk about what they're used for, but they do not lift tissue that's fallen. Things that are sagging, a cream is not going to fix. They're part of the treatment, but they're not the treatment. So I encourage patients use medical grade skincare products, specifically growth factors and peptide serums, but they are used kind of as a supportive function, not as something that is the sole treatment option. Part of the treatment is energy devices. So think radio frequency microneedling. That is, another treatment that helps to stimulate collagen, improve skin texture, and at the same time, it's not going to reposition the deeper tissues, the SMAS layer. Those devices shouldn't and don't reach deep enough to do anything to the SMAS layer, which is really where the problem, SMAS and muscle layer is really a problem. So these really work best for very, very early signs of aging in the lower face and neck. Once they become obvious, probably past the point of energy devices being really useful. The third thing that people hear a lot of is fillers, injectable fillers, things like Restylane, Juvederm, RHA line. There's all sorts of them. And these really need to be approached with caution when you're dealing with the lower face and neck. I've got a whole show called Fillers Don't Lift for this reason. Fillers fill. They replace volume that's lost naturally during the course of aging. Where that works the best is in the midface. So under the eyes and cheeks. They are going to improve your facial shape a little bit if you've got volume loss in these areas. They are not going to lift jowls. They are not going to improve your neck. So don't think that fillers are going to help those areas, and don't let anybody tell you that they will, because they don't. The problem as we get older is that our face becomes bottom heavy. If you think of your face, the face when you're young is being kind of heart or diamond shaped. As we age, that shape becomes more square. It becomes heavier at the bottom. Adding more volume to the bottom part of a heavy square makes the bottom part heavier. It looks worse. And we're dissolving filler all the time from people who have used lower face fillers, thinking that it's going to improve things. That actually makes them worse. Jowls are due to tissue descent and laxity, not loss of volume. So don't try and fix descent and laxity with volume. It doesn't work. Threads are also pretty popular at lifting something minimally invasive. I've said this before. I've used fillers or I've used threads. They don't work. They may work for a week or two, but they're not going to give you lasting changes, and they're obscenely expensive for what they do. So you want a quick lift for an event that's coming up in a week or two, maybe, but know you're going to be paying a lot for a little, and it's not going to last very long. Next up, liposuction. Don't do it in the lower face and neck. It's a good adjunct, meaning it's another add-on treatment that may be helpful in a certain number of people. Those people tend to be young, who have a lot of fat between their skin and the muscle of their neck. There are more problems that occur that causes than there are problems that it fixes long term. What does it not fix? Doesn't fix banding in the neck, doesn't fix skin laxity, and it doesn't fix jowls. These are not, in a vast majority of people, jowls are not your lower face getting fat. They're tissue that has dropped. And so liposuction isn't the answer for that. It can be a part of it, but it's not the whole treatment. The gold standard treatment, kind of the best of the best for jowls and neck laxity, is a lower face and neck lift, a deep lower face and neck lift, where we're lifting and reshaping those tissues that have descended that are causing your bottom of your face to be square, your neck to be saggy and droopy. That addresses the SMAS layer, so the fascial and muscle layer in your face and neck, which includes your platysma muscle in your neck. It lifts fat pads that have fallen. It improves jawline contour. It improves jowling. It improves neck contour and shape. And these surgical procedures address the underlying cause of what you're seeing when you look in the mirror. They're not just trying to reshape things by tightening the surface or tightening the skin. They're not skin treatments. Modern deep plane techniques and extended SMAS techniques, the results are very natural. You can go on my website, you can go to my Instagram, see my own results. You can Google across the internet, see results from other surgeons that use these techniques. They look very natural. This windblown kind of stuck in a wind tunnel look of facelifts of old are gone. You're not going to look like Kenny Rogers. You're not going to have a mouth that goes from ear to ear like Meg Ryan. Not to throw shade, I like Meg Ryan's movies, but you want to look natural and refreshed, not like you've had surgery. So does this mean that everybody needs surgery? Not at all. Not at all. There are a lot of our non-surgical things are really good for younger patients who are starting to see early changes. And that's why, kind of addressing things early is important. But, what I typically will tell people is, if you can look in the mirror and take 2 fingers and lift your jowls up and give yourself a good jawline contour, that's probably means that surgery is the answer. If things barely move, you already have a nice contour and you don't need to pull a lot to get a result, non-surgical treatments may be something worth considering. That's where a consultation with a board-certified plastic surgeon, me, if you're watching this, or somebody else who has experience in, deep plane facial contouring, is going to be helpful to talk through all of these options and pick the right options and give you a treatment plan that's right for you. So this show is really designed to kind of debunk myths, like most of our shows are, talk about what works and what really works. And, if you're really looking for true jawline and neck restoration, consider talking to somebody about surgery. As always, if you got any comments, shoot me a DM at drjasonhall.com, drop a comment down below on YouTube. Thanks for listening, and we'll see you on the next show.